6, respiratory viruses spread primarily by aerosols. It's not to say they don't spread by droplets, but it is to say that's not the primary spread. This means that if you want to reduce transmissions, you have to affect the aerosols. And there are two main ways: masking and indoor air quality and air exchanges, whether with the outside or via air conditioning. Those are your two mechanisms. It turns out that the two big organizations, the WHO and the CDC in the United States, they somehow would not believe this. They spent a long time denying it was aerosols and emphasizing droplet spread. Kind of stupid. We had lots of data before that it was aerosol, that spread of respiratory viruses by aerosols, and that masks prevent that kind of respiratory spread. We can, again, N95 masks, you need high quality masks. Where's mine? High quality masks. Much better than surgical masks. Why? Why was a surgical mask invented? Why did they invent surgical masks? To prevent the surgeon from getting into the patient, right? Why do you need an N95? Why is it different? Prevents what's out there from getting into you. So much better than a surgical mask is an N95 or KN95 mask. We need to change building codes. Again, I don't know what the situation in Taiwan is. Not a lot of public interest in changing building codes, but it's the easiest thing to do. As I said, environmental changes are much easier than human behavior changes.